Good morning. This is Taha Kass Hout with the Centers for Disease Control and Prevention at CDC at the US here. We're talking to you today about BioSense 2.0. Emerging threats can come from anywhere in the world, and rapid collaboration among different parties, health authorities, and the public is essential. However, this is a challenge in order to paint a picture that what's going on on the ground. Next, please. Previous efforts have focused on a top-down approach. Imagine a net with non-connecting loops where information can slip easily through the holes. Now imagine a net that is fully connected where information can be shared in a timely manner, and also where health authorities and others can respond to these health emerging threats. So BioSense 2.0 has become that platform that allows this cross collaboration among jurisdictions. The shared space here is where jurisdictions can share information horizontally with one another, but most importantly, this space is governed by the local and state communities. With permission from jurisdictions, CDC can now see information based on their permission to see that information. There's also a public access option, which that's really where it provides innovations and also provide feedback back to the community. The simple user interface provides a basic epidemiologic inquiry around what, where, and when. This interface then provides the users with wealth of information in real time to thousands of healthcare providers and other sources of information. Within seconds, BioSense 2.0 provides an easy-to-understand map around the health activity of what's going on, alongside with alerts from news media, social, and others. Users can further provide user input, so you have not just machines working, but also users can provide their insights and input about the event, can also share that information with one another. Here's one type of sharing where it can be within a jurisdiction or among other jurisdictions, so a state to state or county to county or country to country. Sharing can also be among organizations, for example, local and state with federal or with other international organizations. And the users always define the level of granularity of the information being shared, whether it's aggregate or detailed, short period of time, or continuous. Here's an example where multiple jurisdictions on multiple levels sharing information around a national event that starts locally, which is influenza-like illness. So you can see the national picture here. You can easily also zoom into a regional picture. Or be able to provide a state view or even county view data. On the left panel there, you can also stratify by age, gender, ethnicity, the various sources of information that you want. You can also show the percent of the visits or the rate per population density. Another relationship here is only for limited time sharing. You don't have to share data all the time. For example, a sporting event where Indiana wants to share data with New York and Boston for around surrounding the Super Bowl event. Indiana wants to know about the health of the population coming, and we're monitoring for gastrointestinal illness. However, we picked up this news article reporting rash illness around mass gathering the Friday before the event. So now the focus easily was shifted from gastrointestinal to rash-related illness and start monitoring emergency rooms, outpatient clinics in the 3 separate jurisdictions and never had to share data prior to that. The BioSense 2.0 solution is cost-effective. The reason we wanted to do this is because we wanted to sustain long-term for state and local and other partners in academic and all sorts. It's also scalable or elastic. You don't have to go and purchase all that equipment. If there's a pandemic or if there's an event, it can scale with you. We work with these partners to facilitate community-driven governance as well as outreach. Our current outreach activities are around three pillars. We fund state and local health departments to sustain the workforce. We also have challenge grants for health departments to be able to join this program, but also seed innovation grants to academic and others. Thank you.